out of mind, and here and now concepts are seen in sensory motor stage. In this stage, which occurs from birth to around 2 years of age, infants focus on primarily on what they can see and feel right now in their surroundings. They develop a preference for familiar objects and people and do not make associations between objects that are not present. So, ages from birth to till 2 years of age, and the stage is sensory motor. A mother who has a baby who is 3 months old asks the doctor if she can give her infant food cereal. What issues might be caused for this child? So the answer is allergy due to the food content. That is the answer. There could be an allergy. What is not the answer? Risk of UTI, not related. Retarded oromotor development, not related. Contaminated food leading to reflux, not. That's not the answer. Hand to hand shift of movements in a 6-month-old indicates or implies comparison between objects. Identify the incorrect criteria for defining a case of severe acute malnutrition. So, severe acute malnutrition, there are 3 criteria. Weight for height ratio is under 3 standard deviations from the average WHO growth preference. There is bilateral pedal edema and upper middle arm circumference is less than 11.5. So you can remember, like, what is the most common question that we ask child? What is your height and weight? So that is included in the criteria. That should be less than 3 st, weight for a particular height. Match the following with correct responses. So social smile is coming in a 1 or 2 month old. Pincer grasp is coming at 9 to 11 months baby. Walking 1 or 2 steps is coming at 1-year-old. And transfer objects is coming at 5 to 6 months. Social smile 1 to 2 months, pincer grasp 9 to 11 months, walking 1 or 2 steps 12 to 13 months, transfer objects 5 to 6 months. When does a newborn reach half the height of an adult? So that occurs when they are 18 to 24 months. So when the baby is 2-year-old, they are almost as half as an adult. 2-year-old, remember. What is the important fatty acid that is present in breast milk? That is docosahexaenoic acid. Which of the following regarding oxygenation of the fetus or neonate is not true? So we will read the true statements, which is anaerobic metabolism in fetus can cause acidemia. That is correct. The fetus can rapidly wash out CO2 through the placenta. That is correct. Low APGAR score at 1 minute indicates the need of immediate PPV, positive pressure ventilation. That is correct. What is not correct is that APGAR score at 7 minutes indicates neonatal death. APGAR score may be low, but it indicates cerebral palsy or morbidity, but not mortality. A 7-year-old child who has ingested button battery is immediately taken to the emergency room. An X-ray is revealed and the battery was in the child's duodenum. The child is asymptomatic. What should be done next? So according to the most latest guidelines, they say repeat X-ray after 7 days. Because if it has passed the cricopharyngeus, which is the most constricted part, then it will pass out by itself. Which of the following milestone is missing in a 3-year-old child considered to have delayed development? So we'll see what a 3-year-old normally does. So gross motor, a 3-year-old is supposed to be balancing and running, and fine motor, a 3-year-old should be self-dressing. balancing and running. In the options, the answer is feeding by spoon. A 3-year-old should be able to feed themselves by spoon. Craniophagus is basically a fusion of head only. Which of this is not an alternative way to measure height in a 4-year-old? Head circumference, knee height, arm span, stadiometer. Answer is head circumference. That we cannot measure height from a head circumference. Handedness is established by 3-year-old. Earlier we learned that 3-year-old are supposed to balance and run. They feed themselves by a spoon. They can dress themselves. And now we are learning that handedness is developed by 3-year-old. So by the hand by which they will hold the spoon will be the handedness. Which is the ideal maintainable fluid of choice in children? 5% dextrose and normal saline. That is the fluid maintenance choice. 5% dextrose and normal saline. It is not to be given in intracranial bleeds, I guess. Which is the rate of increase in head circumference in the first 3 months of life? It should be 2 centimeter per month. First 3 months of life is 2 centimeter per month. Earlier than this, we learned that first 3 months of life, the weight increases 30 grams per day and the head is increasing 2 centimeter per month. First 3 months of life. After that, for the next 3 months, it becomes half of that, 1 centimeter. And after that, for the next 6 months, it becomes even more half. So, if you remember that for the first 3 months, head circumference increases by 2 centimeter. For the next 3 months, 1 centimeter. And then for the next 3 months, followed by another 3 months. So, total 6 months, 0.5. What is wrong about rotavirus vaccine? It is given orally, that's correct. Subunit vaccine, that's not correct. Rotavirus is not a subunit vaccine. It is an oral live attenuated vaccine. So it is an oral live vaccine. The other correct options are, it is not to be given after 8 months of age, and it is available as a monovalent and pentavalent subtypes. So height for weight is minus 1.2 st. Height for age minus 2.5 and weight for age minus 2.7. So this weight for age is more than 2.5. Chronic malnutrition. According to WHO, since height for age is less than minus 2, but weight for height is normal, the diagnosis is chronic malnutrition. So the baby's height is less than age, right? Minus 2.5 st. It should be not more than minus 2, but it is more than minus 2. And weight for height is normal. It should be between plus 2 to minus 2. So here it is minus 1.2, so that's normal. So basically, this is a small child. Like in a classroom, you will see a child whose height is also small, but according to their height, their weight is also less. So it is a chronic malnutrition. 15-year-old boy presents with a short stature. His upper segment lower segment ratio is 0.8:1. Which of the following is likely the diagnosis? So let's see. Normal UL segment ratio in child more than 7 years is 1. Causes for low UL ratio. When the UL ratio will be low, when the legs will be longer than the torso. So the legs are longer in spondyloepiphyseal dysplasia, Marfan syndrome, vertebral anomalies. In here, the legs are longer, the torso is shorter. Spondyloepiphyseal dysplasia, Marfan syndrome, vertebral anomalies. High UL ratio will be when torso is longer. So torso is longer and legs are shorter in rickets, achondroplasia, Turner syndrome, congenital hypothyroidism. We have seen people with achondroplasia, they have normal torso but shorter legs. So you can remember that. Here they are asking lower segment is 0.8 is to 1. Normal ratio is 1. This ratio is decreased, so legs are longer. Achondroplasia, no, legs are shorter. Spondyloepiphyseal dysplasia, yes, legs are longer, so that's your answer. Hypothyroidism, no, legs are shorter. In hypothyroidism, there is a less development of hands and feet. Growth hormone deficiency, we don't know, but we know that spondyloepiphyseal dysplasia, legs are longer, so in growth hormone, legs will be shorter. So it is contraindicated in discharge for sure. So A has to be in the option, so we have 1 and 3 now. So we will go with option 3. Okay, sorry, the question was in which live vaccine is not contraindicated. So then it is D only. So live vaccine is contraindicated in discharge, Wiskott-Aldrich syndrome, and ataxia telangiectasia. So in discharge or catch-22, we have 22q11 deletions, and catch-22 stands for cardiac anomalies, abnormal facies, thymic aplasia, capillate, and hypocalcemia. Wiskott-Aldrich syndrome is X-linked recessive immunodeficiency disorder, mutation in WASP protein, affects T lymphocytes. It has eczema, thrombocytopenia, loss of cell-mediated immunity. Ataxia telangiectasia is caused by mutations in the ATM gene. AT is already in the name, so ataxia telangiectasia, which is essential for repairing double-stranded DNA breaks. This defect in DNA repair impairs immunoglobulin isotype switching and the formation of antigen receptors, resulting in partial T cell deficiency. Consequently, live vaccines are contraindicated in this patient. So wherever you have T cells affected, no live vaccines. In catch-22 discharge syndrome, there is loss of T cell maturation because of thymic aplasia. In complement deficiency, you can give. The next step in the evaluation of a newborn at 48 hours after birth who has history of not passing meconium is lower GI study. What are you testing for? Delayed passage is due to prematurity, sepsis, respiratory distress, or GIT obstruction. Lower GI study can give you causes like obstruction or Hirschsprung disease. Which among the following is concerning if observed on day 10 of life? Conjugated hyperbilirubinemia. Physiological jaundice, which also relieves by 7th day, is unconjugated. So on the 10th day, if you're having conjugated, it is worrisome. A newborn is experiencing bilious vomiting on the first day of life. The initial investigation carried out should be Abdominal X-ray. You'll see the site of obstruction. The initial investigation to be carried out in a case of bilious vomiting should be an abdominal X-ray erect. A neonate passing bilious vomiting can have three diagnoses which is differentiated on the basis of X-ray. First is duodenal atresia, double bubble, jejunal atresia, triple bubble, small bowel obstruction, multiple dilated loops. Congenital hypertrophic pyloric stenosis, you will have non-bilious vomiting because the obstruction is before the sphincter of Oddi or the opening. Duodenal atresia is after, so you'll see bilious vomiting. Jejunal, you'll see bilious vomiting. Intussusception, you'll see red currant jelly stools passage. Meconium ileus, failure to pass meconium with dilated bowel loops. Which statement regarding congenital CMV infection is correct? So it is the most common cause of non-syndromic sensory neural hearing loss. That is correct about CMV. Perinatal diagnosis includes the presence of IgM antibodies in the mother. Postnatal diagnosis involves isolation of virus from the urine or saliva via DNA, PCR, or culture within the first few weeks of life. CMV is the most common cause of non-genetic cause of SNHL. Congenital CMV infection is mostly asymptomatic at birth and symptoms occur only in 10% of neonates. Asymptomatic newborns have lesser risk of sequelae as compared to others. How do you calculate Silverman-Anderson score of a child? So you have three grades, grade 0, grade 1, grade 2. You see upper chest, lower chest, xiphoid retraction, Nair's dilatation, and expiration grunt. When you will give no marks? When upper chest is synchronized, there is no retraction, no xiphoid retraction, no flaring, no grunts. But you will give 1 mark when there is lag on inspiration, extraction visible, xiphoid retracted visible, minimal dilatation, and you can hear the grunt with a stethoscope only. Then you give 1 mark. You give 2 marks when there's a seesaw movement of upper and lower chest, marked retraction of the chest, marked xiphoid retraction, marked nasal flaring, and you can hear the grunting with a naked ear. Let's go back. Audible grunting without a stethoscope, so 2. Marked chest and xiphoid retraction, so 2 plus 2, 6. Seesaw moments, again 2, 7, 8. No flaring, so 0, so 8. So whenever they give like extreme cases or symptoms, give them 2 marks. And when they say it's not present, lightly present, give 1 mark. That is your Silverman-Anderson scoring for respiratory distress. What is the significance? A Silverman-Anderson score of 7 or higher denotes significant respiratory distress, obviously. The following is the preferred treatment option for a 4-day-old baby with bilirubin of 8. Continue breastfeeding and phototherapy. 4-day-old baby. What does ABCAR stand for? Appearance, pulse, grimace, activity, respiration. What does ABCAR stand for? Appearance, pulse, grimace, activity, respiration. Which of the following will increase the likelihood that a newborn has respiratory distress syndrome? air bronchogram and chest x-ray.